Hey athletes, it's Dr. Jackson over at the Sports Pod, and today I want to talk a little bit about MCL sprains. So an MCL sprain is actually a strain or a sprain to that ligament on the inside of your knee. The MCL is a ligament that actually attaches your femur to your tibia. So the femur is the biggest bone in your leg or your thigh bone, and it goes from that inside portion of that bone close to the knee, and it crosses the knee joint and actually attaches to your tibia, which is the biggest bone in the lower part of your leg. Now, if you guys are NBA fans or you watch basketball, you'll know that there's a very prominent star out there, superstar, that just went out with an MCL sprain, and he also has a bone bruise. And I'll talk about a bone bruise, what is that, in a later video. But his name would be, yep, you guys guessed it, that's Kevin Durant. So Kevin Durant of the Warriors, the team everybody loves to hate, he recently went out with an MCL sprain. Now, they're saying that he's probably going to be back, hopefully in time for playoffs, but realistically, they're looking at a timeline somewhere between 6 to 8 weeks, on a good note, if he is to actually return at all before the playoffs. So let's talk a little bit about how you injure your MCL. So oftentimes, the MCL is stressed or strained when you have some sort of force coming from the outside of your knee to the inside. So oftentimes it is contact, but it doesn't have to be, a contact injury. But what'll happen is when something contacts the outside of your knee, it causes what we call a valgus force, or like a knock-knee presentation. So on the inside of your knee, you have the ligament right here, and it gets stressed like this, and that can actually cause a strain. So there's 3 grades, of the sprain strain as far as ligaments go. Now, grade 1 is not very severe. This could only maybe take as little as a couple weeks to heal properly and get back to full function on the court. But having said that, with a grade 1, there's going to be, very little, if any, bruising or swelling. There's going to be a little bit of pain on that kind of medial joint, area. You shouldn't really have any laxity in the joint. So if you stress the joint in that kind of knock-knee presentation like I was just explaining, you really shouldn't feel any laxity. Now, a grade 2 is a little bit more severe. This is actually what they diagnosed, Kevin Durant with, as a grade 2. You're going to have a little bit of pain and swelling, maybe a little bit of bruising in there. It's not really going to be significant. And, you shouldn't really have a ton of joint play, maybe just a tiny bit towards end range, but you're looking, somewhere in the neighborhood of up to 50, percent, maybe even 70% on the really high side of that, ligament that's actually maybe torn or stressed, and this is going to take about double the amount of time. So that's why they said, maybe 4 to 8 weeks for him to get back on the court. Now, grade 3, that's the most severe. That's going to be when you have at least 50 to 75% or more, up to a complete tear of that ligament. You're definitely going to have, a significant amount of bruising, swelling, tenderness on the inside of your joint. And oftentimes when you have a complete tear of the MCL, you also have other structures involved, such as the ACL or maybe even meniscus. And those are going to account for a lot of that swelling and bruising, in the area. So, having said this, there's a lot of superstars out there in pretty much all sports that have had some sort of, serious knee injury, and they're back out there, in the game, and they're playing well, and they're competing at an elite level. So don't let this get your hopes down. If you feel like you've, strained your MCL, definitely go get it checked out. You can come see us at the Sports Pod. We'd love to take care of that for you. I mean, this is something we specialize in, is treating, sports-related injuries. We see tons of knee problems in our clinic, and I can definitely help you out with that. So if you're feeling some pain, on the inside of your knee, and you're not really sure what's going on, maybe it's been nagging on for, a few days or a few weeks, then go ahead and give us a call. Some kind of, key factors to think about, whether or not you may or may not have a tear or a sprain to your MCL is, just think about, what you're doing on a day-to-day basis. Do you have pain with walking? Does it hurt to, go up and down stairs? Is there any swelling? Did in fact you hear a pop or a click, when you injured it, etc., etc.? Definitely go get it checked out. I hope you learned something from this video. Feel free to give me a call or at 214-862-1469 if you have any questions, or you can just reach me on social media. That should be down here in my left-hand corner, your right-hand corner. If not, have a good one and move free, guys.